Experts speak on veteran and active duty personnel concerning post-traumatic stress disorder and suicide. A presentation by experts. Eric Boozer, 14 August 2014. Psychology 496. A brief overview, diagnosing and treating PTSD and suicide risks. The time frame between diagnosis and treatment start, as well as treatment start and results, and how it affects suicide risk in veterans and active duty personnel. It is important to suicide prevention that the time frames be as short as possible. Some of the issues are individuals with PTSD are not getting diagnosed properly. Treatment start is taking too long from diagnosis, and the progression of treatment is insufficient in producing early results. The questions are the primary care managers equipped with the knowledge to recognize signs of PTSD? And does improved treatment times help in preventing suicide in our veterans? Our experts today are Dr. Marie Burr. She has a PhD in psychiatry. She graduated from Georgetown University in 1978 and currently works as a mental behavioral health counselor at the Veterans Medical Center in Columbia, South Carolina. Our second expert is Ms. Adrienne Smith. She has a master's in counseling. She graduated from Columbia International University in 2008. She's a counselor at the Post-Trauma Resource, Columbia, South Carolina. In Dr. Burr's experience at the Veterans Medical Center, it has become an issue with primary care managers and the diagnosis of PTSD. Many individuals who are diagnosed with PTSD are done so while seeking medical attention for symptoms of PTSD, such as sleep issues and anxiety. Training needs to be conducted to help care managers recognize these symptoms and refer the individuals to the proper mental health provider. It is important that the primary care managers are capable of recognizing these symptoms when the veterans come in for treatment. It has been identified that a delay in treatment can lead to suicide among PTSD patients without strong support systems. For more on the VA treatment information, visit the VA website listed below. Our second expert, Ms. Adrienne Smith. As her time as a counselor, she has identified an issue of treatment progress and suicide. The faster an individual suffering from PTSD sees results, the less likely they are to attempt suicide or drop out of the program. And the same results from having a strong support relationship with family and by having an extended suicide prevention support following treatment. Ms. Smith has also identified a lack of desire on the part of individuals, especially active duty, to seek mental health support, mainly due to the stigma associated with mental treatment. For more information on PTSD and suicide, she suggests you visit the website listed below at suicide.org. In the compare and contrast, as you can see with Dr. Burr, the question was with the PTSD symptoms and the PCM training. Are the PCMs trained enough to recognize the symptoms where they can refer the individuals to the proper mental health facilities? For Ms. Smith, the problem is the treatment results. They need to be quick. The faster the results, the less likely the individual is to drop out of the program or commit suicide. The other issue is the PTSD stigma that goes along with seeking medical attention, especially for our active duty personnel. The one thing that they both brought up in their statements was the support. It is very important to have a strong support system with both family, with your counseling team, as well as following your counseling sessions. That concludes this presentation. I hope you enjoyed it, and I thank you for listening.